Hello, I'm Anjilee Istewal, and once again we are seeing a slight rise in the number of daily cases in Europe. And we have earlier seen that once the cases rise in Europe, the pattern follows suit in America. America is just now getting over its last wave. We are seeing a tapering down of the daily number of cases coming in, and also the number of deaths being reported daily. And while America has been grappling with all that, suddenly the new surge of cases that we are seeing in Europe, there is a very strong possibility that this surge will be replicated in America also, because we've seen this pattern earlier in the pandemic. Now, the big question is, why are the cases rising in Europe? Well, people say it's due to the stealth variant, subvariant to be more precise. Well, there's nothing much stealth about it. It is a subvariant of Omicron. We all know that the virus keeps changing the way it's created. We see a few changes in the spike proteins, and because of that, the virus forms various variants. And these variants, when they say a few changes happening to them, but not enough to club them or to categorize them into another variant, then we call it a subvariant. And that's exactly what the subvariant is, and that is exactly what is right now in the reason for increasing cases in Europe. It's a subvariant called BA2. This is a subvariant of Omicron. So when we saw the Omicron wave, we saw that it was a little less severe. It did not cause deaths like the earlier Delta variant or the Alpha variant in Europe, but it was a significantly more transmissible variant. That definitely was there. So what about this subvariant? Well, is it more transmissible? Yes, it is more transmissible as expected. Is it more deadly? No, it is not more deadly. It's not been proven in any studies till now. Does it cause more severe disease? No, it has not been proven in any disease that it causes more severe disease. So one thing is clear, that the variant in itself does not seem to be any more dangerous than Omicron. But are the vaccines effective on it? Most of the initial studies say that the vaccines are as effective on it as we've seen in Omicron. There was a fall in the efficacy of the vaccines as compared to the earlier variants, but it is still quite effective on the Omicron variant. So we would assume that the subvariant is also affected by the vaccines. But the big question, another big question is, will it lead to another surge? Well, that is a possibility, like we saw in Omicron last time. This will lead to a surge, and once the surge happens, the one thing that I predict could be a problem is, earlier with Omicron, we could easily, without doing genetic sequencing, identify the variant, and accordingly, the medical experts could move forward with the kind of treatment protocol they were advised. But now, if this supposedly stealth variant, what it does is, it does not follow suit as far as the PCR testing is concerned, as in the way we could identify that this is Omicron variant in the PCR testing. This cannot be done in the new subvariant. So that means once let's say a patient walks into a hospital and says, I am positive, or says, I'm not feeling well, he will have to be tested, and they will have to try and find out what exactly is the variant that he is suffering from, and then accordingly the medical treatment will have to be decided, because we have seen that the monoclonal antibody cocktail did not really work that well with the Omicron, whereas it was working very well with Delta. So now the doctors have to see that. Anyway, this is going to be a problem for the medical practitioners as this surge continues. But another big question is, why did this happen? Well, this happened because most of these countries relaxed all those restrictions that were put in place because of coronavirus. While the economic challenges are important and they need to be tackled, the big question was, why do away with masks? Western countries have had this quite puzzling reaction to the mask, which we've not seen in our country. But they have had this inhibition in wearing masks, which was evident not just in Europe but also in America, more so in America. And removal of any mandate to wear masks even inside the rooms, inside buildings, inside close quarters, that is not a very smart thing to do. And as we see, every time we remove all these mask restrictions, the coronavirus cases start rising. We saw that in America. If you see, CDC removed mask restrictions in June, and we saw a wave coming in after June. We saw that happening in November as well. Mask restrictions were eased, and again, the same thing happened. So this is something that is going to be, I would call a food for thought for these countries. Do we really need to do away with these mask restrictions so quickly? What is the problem in wearing the mask? We can wear the mask. Depending on where you are, what sort of a situation you are in, what is the situation of coronavirus in your country, mask is something that is one of the easiest ways to control coronavirus, and maybe these countries need to think about it.